I am Dr. Mav, and I'll be taking care of you this evening. Good job, my friend. Just look at the light. Just keep looking. Another triangle. Yes, but what I was really looking for was a Death Star. You were close, though, so I'll give you that. Keep looking at my nose, please. Right here. What color is that? Red. Good job. You're sitting on the water's edge, reading a book, and you feel the warmth of the sun on the back of your neck. Hey there, welcome in. Please take a seat. Let me just get your name. Good. And your street address? Okay. Zip code? Perfect. All right. Well, I am Dr. Mav, and I'll be taking care of you this evening. I've just got a couple notes here to take. Okay. I will be conducting a cranial nerve exam. This process is going to be lengthy, but quite relaxing, okay? And to start the exam, I just want to take a listen to your lungs. Okay. Okay. I'm just going to get nice and close here and listen to your lungs here. I'm going to reach around and put this on your upper back. Okay. Good. Okay. Go ahead and take a deep breath in for me. And out. And inhale. And exhale for me. Good. And inhale. And exhale. Good. Very therapeutic. Inhale. And softly exhale. Very relaxing. Good job. And breathe in for me. And exhale. Good. Just take a couple normal breaths for me. Good. Thank you. Okay, I'm just going to put this on your chest here and listen to your heart. This always reminds me of drums. lungs and your heart sound extremely healthy. I'm just going to take a quick note here. Good job. Okay, my friend. I've got some latex gloves here. I like to put these on before the examination. I feel like not only does it make me feel more like a doctor, but I think it's safe to say that it does have a cleanliness to it. Even though my hands are clean, it's better to be safe than sorry. Okay. I have a brush here and a somewhat of a sharp tool. There's no sharp edges to it. It's not going to harm you. And I'm just going to gently touch your face with the soft brush or the sharp tool. And I would just like for you to tell me, once you close your eyes, if you feel soft or sharp, okay? And the reason I'm doing this is to ensure that the neurological response time is efficient and effective with, and it comprehends, right, the face, okay? Okay. Go ahead and close your eyes for me. I'm going to get somewhat close, okay? Soft, good. Sharp. Mm-hmm. Soft, very good. did like the neurological response time between your mind comprehending what is happening to your face. And that's important. The mind needs to know what is happening to the body. Good job. Okay, for this next portion of the test, I'm just going to do an eye exam, okay? And some folks find this relaxing, and some even tend to almost fall asleep during this portion of the test, and that's perfectly fine. I'll just wake you up gently, but I'll wake you up. No. Okay. So, I do have a little pen light here, as you can tell, as you can see. So, what I'm going to do is I'm just going to ask you to follow the light. Simply that, okay? Just look at the light. Wherever the light goes, just look at the light. Good. Good job. Yes. Good. Just look at the light. Wherever the light goes, just look at the light. You're doing great. Yes. Just look at the light. Good job, my friend. I'm just looking at your pupils and seeing the dilation response time is effective and quite efficient. That's what we like to see here at the clinic. Good. Just look at the light. Wherever the light goes, just look at the light. Good job, my friend. Just look at the light. Just keep looking. Just keep looking. Just look at the light. Just keep looking. That's all you have to do is just keep looking. Good. And I'm going to get close, but the light is going to get far. Just keep looking. Just keep looking. Just look at the light. Look at the light. Right here. Just look at the light. Look at the light. Just look at the light. Good. Okay. Good job. And then if you could just look to your right for me. Okay, good. And look to the left. Good job. Excellent. Okay. Now for the next portion of the test of the eye exam, I'm going to close your eyes with my hand. Okay, I'm going to cover your eyes. And then I just want you, it's okay if you close your eyes too. And then I'll have you open your eyes. And wherever the light is, I want you to find it. Okay? Good job. Here we go. Let's begin. Close your eyes. And open. Focus on the light. Good job. Close your eyes and open. Good. Wow, that was quick. Excellent. And open, or close. Open your eyes. Here we go. Close your eyes for me. And open. Good, good. Close your eyes. And open. Good job, my friend. Go ahead and close your eyes. And open. Good. Close your eyes. And open. Good, 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 good. Close your eyes and open. Good. Excellent work. Okay. For this next portion of the eye exam, I'm going to simply draw shapes in the air with my pen light, and I want you to tell me what you see. Okay? Let's begin. Circle. Good. What shape do you see? Square. Excellent. What shape is that? Yes, a rectangle. Excellent. What shape do you see here? What is that? A triangle. Good. And then what shape is this? Another triangle. Yes, but what I was really looking for was a Death Star. You were close though, so I'll give you that. Okay. Okay. I just want to finish this eye exam by simply examining your eyes. So, if you would, just look right here at my nose, please. Okay. Good job. Okay. Keep looking at my nose, please. Right here. Good. Yes. Right here. Just look at my nose. Please. Look right here. Good job. Thank you. Excellent. Okay. I'm just going to look in the other eye, please. Look at my nose here. Good. Okay. Okay. Just right here. Look at my nose. Good, 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 good. Okay. Not quite finished. Okay, it's a different temperature of light. And I still am going to examine the eye. If I can get it to work. Let's see here. There we go. Okay, now, if you could just look right here at my nose, please. Good, I know it's just a little bit bright, but that is Okay. And now for this next portion, I'm going to get up close and personal. Up in your bubble. So I do apologize. Okay. Just gonna get nice and close here. Just going to look right here at my nose, please. Good. Mm-hmm. Good. Okay. Keep looking right here at my nose, please. Good job, right here. Keep looking. Okay. Good job. Okay. Good job, my friend. Okay. You did great, my friend. I'm just going to take a quick note of that, okay? Just to document. Just need to document the results. Which again, you passed that portion of the test. You're doing great, my friend. It's definitely summertime, as you can hear out the clinic window. We have a little visitor. I wonder if he needs a cranial nerve exam. Okay. Okay. So, I almost forgot. There is one last item. This portion of the test for the eyes. Okay. And I can always update the logs here. So, I just simply want you to tell me what color you see. I'm going to spin the jar, and whatever color I point to, I would like for you to tell me, okay? Let's begin. What color is this here? What color is that? Red. Good job. How about this one? What color is that? White. Excellent. How about this color? What color is that? Brown. Yes. Oh, how about this one? It's quite vibrant. Red. Excellent job. What color is this? this one right here. What color is this? Tan. Yes. Excellent job. It's almost like an off-white. I would have accepted that as well. And then, how about this one at the bottom? Pink. Excellent. Excellent. Very good, my friend. Okay, now I can update the logs here. Excellent. Okay. For this next portion of the test, I am going to simply cleanse the air in preparation of the smell test that is coming up, okay? And I have here 2 air purifiers. So you can just sit back and relax and either listen or you can close your eyes and go somewhere mentally, somewhere safe, maybe somewhere happy. Good. You're doing great, my friend. Yes. Yes, it is quite relaxing. A lot of my patients find this part extremely relaxing. It's very cozy. The sounds that it makes as it cleanses the air. And the mist that gently touches your face. It's both cozy and it tickles a little bit. It just makes you feel happy. Makes you feel good. It makes you feel relaxed. Good job. Good job, my friend. Good job. Okay. Now, I have a couple of these vials here. I'm just going to spray the air, and I want you to inhale It's completely safe. It's harmless. It's just a fragrance that I want you to smell and tell me what you smell. What scent is that you smell? There is no wrong answer. You just need to tell me what it is that you think you smell. Okay. Here we go. What is that? What do you think you smell? Lavender. Interesting. Okay. Just shake up this next vial. Okay. Okay. And what do you smell? Lemon. Yeah, I feel like that one's kind of easy. I might need to get new ones. That one's too easy. Okay, I've got this one here. Okay. If I can get the lid off, there we go. Okay. And what do you smell on that one? Chocolate. Interesting. I do like that smell. Okay. Chocolate. Mm-mm-mm. What is your favorite chocolate? Just out of curiosity. Ooh, that's a good one. I would have to agree. I think that one's my favorite as well. We have something in common. Okay. And what do you smell here? Yeah, that one's a bit more fruity. Take a guess. Strawberry. Good job. I do like that scent. I feel like it's perfect for a summer night. Good job. Okay, and this is my last one, okay? Just shake up the fragrance here. Okay. And what do you smell? A mocha latte. Mm-mm-mm. Oh, what I would do. I could go for a mocha latte right about now. You too? Yeah. Mocha lattes are pretty good. Okay. I'm just going to take a quick note of that. this next portion of the test, I'm just going to inspect your mouth and maybe clean it up a little bit if needed, in preparation for the taste test that is coming up. Okay, so if you could just sit back, relax, you can open your mouth for me, and I'll just inspect it, okay? I'm gonna get nice and close for this. I'm gonna get right up in your bubble. Okay. Good. Good job. Just gently inspecting each and every tooth right now before I look at your gums. Good. You're doing great, my friend. Okay, perfect. Okay. If you could open your mouth one more time, I'm just gonna take these gentle, soft tweezers and just gently rub your gums, okay? Go ahead. Okay, good. Good job, my friend. Nothing seems to be out of the ordinary. You have very healthy teeth, very healthy gums. How often do you brush a day? Good. I'm not a dentist, but I do know that much. Good job, my friend. Excellent. Okay. For this next portion of the test, I have these little containers with flavored liquid, okay? And what I need you to do is simply take a taste. Take a taste. Take a taste. Wow. Tongue twister. Take a taste of this and let me know what it is that you taste, okay? Take a taste. Take a taste. You think I would know how to say that by now? That is correct. You've got incredible taste buds. Okay. On to the next. No, you can't have that. I know it tastes good. It's just a sample. They should make that a drink, though, I do agree. A blueberry muffin drink. It sounds weird, but I feel like that would taste really good. They make blueberry, like, coffee creamers, so I feel like that would be the same. Okay. You're funny. Okay. Take a sip of this for me, please. Good. A bit citrusy, yes. Orange. Good job. Orange is the right flavor. Good job. Okay, moving right along. Okay. Okay, and take a sip of that for me. Good. And what do you taste? Watermelon, yeah, good job. Okay. Just shaking up the flavor, I suppose. Mixing it all up. Okay. Okay, my friend, take a sip of this one here. Good. Oops. I can get the lid on straight. Okay, there we go. A vanilla milkshake. Yes, that is a good one. Okay. Last one. Good job, my friend. You passed the taste test with flying colors. You did marvelous. Good, good job. Okay, my friend. We're going to move right into the hearing test portion of the cranial nerve exam. I just need you to simply close your eyes and tell me what ear you hear the next item. I'm just going to simply make some noise quite finished, but I'm just going to take a quick log of what we have performed so far. Good. Okay. With your eyes closed once again, I'm going to make some sounds, and I just want you to simply tell me what it reminds you of, or what it makes you think of. Okay? Yes, that simple. Okay. Go ahead and close your eyes. Good. What does that remind you of? What does that make you think of? Water dripping. Okay. What else? Interesting. I've never heard anybody say that before. It reminds you of a tiny, tiny beach with tiny, tiny waves crashing on the tiny, tiny sand. That's adorable. Okay. What else does it remind you of? What does it make you think of? Just clear your mind and listen to the sounds of the liquid and let it take you there. Okay, so it makes you think of a stream. Or a brook. Very good. You're sitting on the water's edge, reading a book, and you feel the warmth of the sun on the back of your neck. As you listen to the flow of the stream. That sounds very relaxing. Good job, my friend. Excellent job, my friend. Good job. Okay. For this next portion of the hearing exam, the hearing test, I am going to use a tuning fork, and I would like for you to close your eyes once more, and I want you to tell me when you stop hearing the sound. I like the sound that my bag makes. Inside this bag are the tuning forks. This isn't really a part of the test per se, but I find it quite relaxing. There's just something about it. Okay. Excellent work, my friend. Good job. Good job, my friend. You passed that portion as well, which concludes our cranial nerve exam. I love what I see, my friend. Good job. You did great. You did wonderful. You did fantastically. So I just want to say thank you for coming this evening to the clinic. And if you would, stop by the front desk clerk and make another appointment to come see me sometime. Okay? I'd love to see you again.